Hello, this is Dr. Gil Wilshire, Columbia, Missouri Fertility. Today we're doing something called a tubal cannulation. Our patient today was told that she had blocked fallopian tubes. She had a laparoscopy a number of months ago and they were unable to get dye out through the tubes. Today we're going to see if that is really true. What we're doing is we're starting out with something called a hysteroscopy. We're looking in her uterus and we've opened up the inside of the uterus with salt water under pressure. We've cleaned out some polyps and some other abnormalities, and now we're able to see the inside of the uterus and the opening of fallopian tubes. This is the inside of the uterus called the endometrial cavity, and you can see the openings of both fallopian tubes. There's the left, which is on our right, and the right, which is on our left. So what we're going to do now is we're going to take a wire. It's called a Urologic Fly Wire. We borrow this tube from this wire from urologists. They use these to get out kidney stones. And we're going to put this wire up into this tube. That's called the ostium. We're going to put the wire in the tube, and look at that. Pop through a slight obstruction, and you can see the wire going up the tube. I bet you that tube is nicely open now. So we're going to slide the wire out. Fantastic. The right tube is probably open now. And now we'll go over to the left side and perform a similar procedure. There's the opening of the tube, the ostium. We're going to advance the wire. A little obstruction there. We're going to see if we can get it through, and it does. Fantastic. So that wire slides up as well. So I bet you the left tube is open as well. So there you have it. There, and I'm going to take a picture while I'm here. Very good. So there you have it. That's called a tubal cannulation. Both the tubes in this nice woman are now open, and I suspect she'll be able to have babies with very little difficulty at this point. Thank you very much. This is Dr. Wilshire at Columbia, Missouri, at Missouri Fertility.